The similarity between the clinical manifestation of migraine and the narcotic abstinence syndrome prompted the investigation of endogenous opioid receptor systems in migraineurs. A decreased level of CSF opiates during migraine attack, when elevated levels would be expected, and hypersensitivity of receptors to hydroxytryptamine 5-HT may suggest that an abnormality in the opioid receptors and other neurotransmitter binding sites, such as in the individuals prone to migraine, and continual emotional stress resulted in decrease in the release of endogenous opiates, and the sudden results in release of endogenous opiates, and the sudden cessation of tension may cause an abrupt drop in and the sudden cessation of tension may cause an abrupt drop in endogenous opiates level. This may account for the common occurrence of migraine on weekends and when vacations begin. There are decreased peripheral blood mononuclear cell beta endorphin or concentrations on both the patients whose migraines were treated with either acupuncture or sham acupuncture. The degree of relief of experienced was proportionate to the rise in the plasma propanoid and beta endorphin levels. So to continue my lecture, there are decreased peripheral blood mononuclear cell beta endorphin concentrations in both patients whose migraines occur with or without aura. When the children with migraine were treated with either acupuncture or sham acupuncture, the degree of relief experienced was proportionate to the rise in the plasma propion and beta endorphin levels. Matched children without migraines had higher levels of propion. Migraine is genetically complex. Studies of monozygotic or dizygotic twins have supported a genetic contribution to migraine. When the parents of patients with migraine without aura were interviewed directly, 91% of the patients had one or both parents with migraines. The findings suggest that an autosomal dominant transmission. The rare syndrome of mitochondrial encephalomyopathy, lactic acidosis, and stroke-like episodes has been attributed to a mutation of mitochondrial DNA. More recently, from familial hemiplegic migraine was linked to a mutation of chromosome 19 in 55% of the familial hemiplegic migraine, that is FHM families. Later, FHM in 15% of fatalities was linked to chromosome 1. In the remaining 30% of FHM families, there were no linkage to either chromosome 1 or 19, supporting a yet to be defined heterogeneity. It is not clear whether common forms of migraines are linked to mutation or chromosomes 1 or 19. In a minority of patients, behavioral symptoms during the day before a migraine, euphoria, irritability, depression, hunger, thirst, and drowsiness are common. Thank you very much. We come to the end of my my lecture, and hope we will continue in the next video with the next part of my lecture.